Hello everyone, my name is Jose Amparo and I'll be talking about coercive paraphilias, which is also known as sexual disorder. So let's get started. Before we get into the details of the different types of paraphilias, I want to let you guys know what is a paraphilia. So according to the DSM, a paraphilia is a condition in which a person's sexual arousal and gratification depend on fantasizing about and engaging in sexual behavior that is atypical and extreme. So that's the basic definition of a paraphilia. We'll be talking about coercive paraphilias, which includes non-consenting individuals. So that's going to be the basic scope of this presentation.
Papa loves mambo. Mama loves mambo.
So the first coercive paraphilia we're going to talk about is called frotteurism, which is the act of touching and rubbing one's genitalia against a non-consenting partner to achieve sexual gratification. And as you can see in that picture and in the video I just showed you, um, individuals that commit this act, they do it specifically so they could get some type of sexual gratification out of it. So common places where frotteurism occurs is in crowded places such as buses, malls, sporting events, concerts. So you'll see a lot of that in those areas. And the way this non-consenting act occurs is usually by commonly an adult male grabs onto you firmly and with usually an erect penis. They have an erect penis when they're trying to rub onto you, and once their victim notices, or once they're already done with their with what they had to do, they just quickly try to get away, and they're usually not caught, or it's very hard to catch them since it's a very quick uh, act that they do. A study showed that approximately 21% of college students have committed frotteurism, but to actually be diagnosed with frotteurism, somebody is supposed to have 6 months of recurrent intense urges or fantasy to touch or rub against a non-consenting person, and the main outcome of that is that they want pure sexual gratification. A lot of these people that commit frotteurism, they usually, once they get away, they go and masturbate in their car or in their house, just knowing that hey, they just went ahead and rubbed themselves against someone. Also, those individuals diagnosed with frotteurism usually experience stress and social dysfunction in their everyday life. Ways of treating uh, frotteurism would be to seek behavioral therapy and be able to gradually get to a point where you're not touching people that are not consenting to that. Another way is to take hormonal medications to decrease the desire of touching non-consenting individuals. And at the end, there's legal consequences that usually force individuals. And now we move to necrophilia. So necrophilia is someone who is sexually attracted to dead human bodies. And this is usually in the terms of fantasizing or actually having sexual contact with corpses. Of course, this is another coercive paraphilia because the body, the corpse, cannot actually consent to any sexual activity. In a study that looked at approximately 35 different cases of necrophilia, found that 68% of individuals desired a non-resisting partner, 21% wanted to reunite with a romantic partner, 15 said they wanted to overcome isolation, and 12% desired self-esteem issues by expressing power over the dead victim. And to reinforce what the study found, we see that possible reasons for necrophilia is poor self-esteem. Individuals feel extremely fearful of rejection, and the main one is that they desire a partner who cannot reject them. Different ways of treating necrophilia would be the implementation of cognitive behavioral therapy, which is usually focusing on the thoughts and behaviors and the emotions of the individual to get them not to perform such deviant acts. And as well as orgasmic conditioning, which is usually having the individual masturbate to more appropriate stimulus. And our last course of paraphilia is pedophilia. Pedophilia is intense sexual urges and fantasies involving sexual activity with a pubescent child aged 13 years or younger. And so someone to be considered a pedophile, they must at least be 16 years of age and be 5 years older than the child. So the overwhelming majority of pedophiles are males. Young girls are twice as likely to be targets of the pedophiles for their sexual gratification. Also, we need to understand that child sexual abuse or child molestation crimes are not confused with pedophilia. A person that's 17 years or younger, it's considered child in legal terms, so try not to get those confused whenever you hear those terms. And lastly, a way to treat pedophilia is to use the multimodal approach, which includes using cognitive behavioral therapy, sex therapy, and intakes of drugs such as male testosterone to reduce sexual impulses or desires to have sexual contact with kids. And there you have it, folks. That this concludes my presentation on coercive paraphilias.